Nomine Domini Patris et Filii Sanctus Amen. But you don't have to do that.
Hey, Steve at Norfolk PT. We're going to talk a little bit about shoulder exercises today. Now, we see a lot of shoulder injuries from total joint replacements to rotator cuff repairs to various sprains and strains. And these exercises were actually designed for somebody with a large irreparable rotator cuff tear. So they had a shoulder in a pretty bad way, so they're safe for virtually anybody to do. But if you have some shoulder issues and want to start on your own, this is some good tips for you. So first of all, the shoulder is in a good position to function when your shoulder blades are back and your chest are out. So that's what you're looking to do. You don't want to be like this. As you can see, if all I do is slouch and bring my head forward, that's as high up as my arm can go. If I have proper posture, immediately I have more range of motion. So that's just a tip for you. You want to always start with your shoulder blades back. So let's start from that position. Now, the first exercise we call table scrubs, because you scrub a table. Again, this is my right arm. We'll pretend this is the arm that has the problem with it. And what you do is you want to put your weight on your left arm, assuming that's okay, so you're not putting a lot of weight on the right. And it's just like you're scrubbing the table. And perhaps scrubs is not the best terminology to use, because if it's painful, you may barely be able to scrub at all. There doesn't have to be a lot of pressure on it. You just want to move it, and we usually have people doing this for 1 or 2 minutes at a time. If you're feeling stronger and it doesn't bother you, you can venture out in different directions across your body, back in here. You can push a little harder so that it's more like a buffing motion, more like a wax on, wax off for those older folks who remember that one. Anyway, so that's how you do that. That's the first exercise. And again, light if it bothers you, stronger if it doesn't, and always, always pain-free. Like a minute or two to start with. Second exercise you do is going to be laying down. So what you do is, we'll get in position here. Lay down, and we call this one the supine Pope. Because if you ever watch the Pope was always blessing people. He's always doing this, and this is the exercise. So what you'll find is if your shoulder is a little dicey, it may hurt you to lift it. So the person that this exercise would be appropriate for is somebody who can lift their own arm up, let it go, and they can hold it there pain-free, okay? That's all you have to be able to do to start this. Then you start blessing people. And again, we usually try for a minute or two of this. If it's painful, you just do little blessings. If you can do bigger ones, you can do bigger ones. And if you know Latin, you can do Nomine Domini Patris et Filii Sanctus Amen. But you don't have to do that. You can just go ahead and keep it small. When you bring it down, grab it with the other arm and lower it. The entire operation should be pain-free. As you get better, you can reach up and do that and make it a bigger motion. Always has to be pain-free. But this is where you can work the rotator cuff in a way that protects it, so if you have some pathology there, you're not aggravating it. So then we'll move on to number 3, which is a standing exercise. This is the third and last exercise of the sequence, and I would caution you, if it gives you any trouble, don't do it. Same thing with the other exercises. Nothing should bother you. You should be able to do it in a pain-free fashion. And of course, if you're having a lot of shoulder trouble, you should probably be seeing a doctor and/or a physical therapist. So this is not to tell you not to seek care. I'm just trying to give you some tidbits on shoulder care and what you might want to be able to do on your own. Now, this one involves reaching overhead. What is a frequent characteristic of shoulder problems is what we in physical therapy call a painful arc. So you'll lift your shoulder, ow, 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 and once you get above that, it's not too bad. That's called a painful arc. So in order to avoid going through the painful arc, we want to get beyond it. So when you do this exercise, if you do have a painful arc, you want to lift the shoulder and put it up on the wall. So this is what it looks like. You're going to lift the shoulder, and assuming you can get it there and it doesn't hurt, put it on the wall above you. Once again, you're going to lean on your arm so the weight isn't on this, and you're going to, in essence, do what we had you do for the table scrub. It's a nice light movement. Again, it's for endurance, and you may want to do that for a minute, 30 seconds, whatever works for you to begin with. So a little light scrubbing like that. Again, it could be very light. And when you're done, bring it back down with the other hand. And remember, bring it up, let it go, lean against this arm, do your scrubbing, grab it, bring it down, and let it down. So those 3 exercises actually will do a really good job of getting you through a lot of shoulder rehab. But again, if you're having troubles, seek medical attention, get the appropriate care you need, and maybe we'll see you in physical therapy.